It's time for an important conversation that impacts millions of Americans. November is Diabetes Awareness Month.
And we're going to unpack this common chronic condition with Dr. Ryan Loftin, who specializes in maternal and fetal medicine with Allina Health. Great to see you.
Thank you so much for having me.
Thanks for coming in. So let's start at the beginning, very basic. What is diabetes?
So diabetes is a chronic disease where the body does not process sugars well, and it can either be type 1 diabetes where the body doesn't produce enough insulin, or an insulin resistance problem where the body makes insulin but doesn't utilize it well. And that can be type 2 diabetes, or in pregnancy, even a gestational diabetes.
Yeah, and we saw these numbers and they stood out to us, predicted some 38 million Americans are actually living with diabetes. Some, as you told us off camera, might not even realize it, not getting diagnosed. In your medical opinion, why is this disease so prevalent nowadays?
Well, certainly we've seen changes in the rates of obesity, and in type 2 diabetes, which is insulin resistance, adipose tissues or fat cells actually make the body more insulin resistant, and so it's one thing that can lead to the other, so they're linked.
Mm-hmm. And it's scary to know that people may not realize they have it. So tell us some of the signs and symptoms of diabetes.
Sure. So, I mean, the classic signs and symptoms would be, being thirsty all the time and hungry, urinating a lot just because the body processes sugars and makes you lose water. But most of the time there's not a lot of symptoms, which is why you need to have a checkup with your doctor to get tested for diabetes. Mm.
And is this something that would happen at a normal checkup, or it's something you would specifically have to ask for?
Sure. So in pregnancy, we routinely will test all pregnant women between about 24 and 28 weeks of pregnancy. And then some women who may have family history or a prior history of diabetes in a prior pregnancy would get tested earlier in the pregnancy as well. And then maybe retested again later, because we really want to make sure that we're getting the diagnosis.
Mm-hmm. What is leading to that staggering number of women with gestational diabetes? You told us it's anywhere from 10, maybe 20% of pregnant women. What's the typical cause here, and what's a way to remediate it?
Yeah, so about 1% of women would have diabetes coming into a pregnancy, so either type 1 or type 2. And the most recent data from the Minnesota Department of Health is about 8.5% of women who are pregnant in Minnesota actually have a diagnosis of gestational diabetes. But there's some controversy about whether we're actually even diagnosing it at the rate that it really exists, and it may be double the rate.
You have a success story to share, a new mom who gave birth to twins and dealt with the condition.
Oh yeah, certainly. So our recent patient had a twin pregnancy as a type 1 diabetic prior to pregnancy, and throughout the pregnancy we followed along and helped her manage her diabetes to get things under control to have the best outcome. And certainly in a pregnancy where you've got 2 babies and 2 placentas that make more hormones that actually make the woman more insulin resistant, it can be tricky to get that managed correctly, but she did great and has 2 beautiful babies.
What advice do you have for women who are just receiving this diagnosis or maybe feeling like they might have the symptoms?
Mm-hmm.
Sure. Talk to your doctor. Get tested if you're seeing a doctor or a midwife for your pregnancy. Just ask the question. Get checked out.
Mm-hmm. And then, if someone might suspect they have diabetes, whether they're pregnant or not, what would be the right way to get at that with your doctor? What should you be asking?
Yeah. So you can go and ask for a diabetes test, and that might be with a screening test like a hemoglobin A1C outside of pregnancy, or a test where you drink a sugary drink, what we call a glucola test, to test to see if your body's blood sugar rises in response abnormally or whether it falls in the normal range.
Yeah, and quickly, a couple of things you can do at home to lower your risk of diabetes.
Always important.
Thank you for asking. So really the basis of managing all diabetes and preventing it is by following a healthy diet and not eating too many sweets and carbohydrates, and getting exercise. Lifestyle management is the key to managing both your risks and the disease, with the assistance of medicine when needed.
Sure.
Words to live by as we enter the holiday.
Yeah, hard to do in November,
season.
easier, come January 1st. So good advice. Thank you so much.
Thank you, Doc.